The new and improved model. Integration of mental health crisis intervention teams and system-wide collaboration. When discussing the reason for a new and improved model, there are many factors that come to light. Untreated mental health issues. When examining mental health disorders among individuals in the criminal justice system, it is often too late, limiting the effectiveness of interventions and rehabilitation efforts. Stigma and misunderstanding. There is a widespread stigma surrounding mental health issues, which often leads to misdiagnosis or delayed treatment, particularly for those involved in criminal behavior. Limited resources. Programs like mental health courts and diversion programs face resource limitations, affecting their ability to offer comprehensive and effective treatment or rehabilitation to all individuals in need. Lack of systemic integration. The criminal justice system and mental health services are often fragmented. The lack of integration between mental health professionals and the justice system can delay diagnosis, treatment, and diversion, reducing the chances for rehabilitation and recovery. Trauma and its effects. Many individuals with mental health disorders in the criminal justice system are survivors of trauma, which can make mental health conditions worse and increase vulnerability to criminal behavior. The improved system proposed is the integrated mental health crisis intervention teams within a system-wide collaborative approach. This model can include the following: early intervention and screening, expansion of mental health crisis intervention teams, collaboration across systems, trauma-informed approach, and expansion of community-based support systems are all components of this model. Early intervention and screenings. At this point of arrest or interaction with law enforcement, individuals would undergo a standardized mental health screening. This would allow early intervention of mental health disorders and the immediate diversion of individuals into appropriate care of treatment instead of incarceration. Expansion of CIT. CIT, which involves trained mental health professionals working with law enforcement officers. This can expand to more stages of the criminal justice process. This includes jails, probation systems, and courts, offering mental health support throughout an individual's journey within the system. Collaboration across systems. The integration of mental health professionals, criminal justice professionals, and social services to work together from the point of arrest to reintegration into the community. This collaboration should aim to create a continuous support system that ensures long-term recovery and reduces the risk of reoffending. A trauma-informed approach. A trauma-informed lens should be applied across the entire criminal justice system to acknowledge how trauma can affect behavior. This approach would help professionals interact with individuals in a way that recognizes their past experiences and provides the necessary care and reducing reoffending chances. Lastly, the expansion of community-based support systems. Mental health courts and diversion programs should be expanded with more resources and support. A key recommendation is to incorporate a community-based support network that continues after treatment and rehabilitation, helping individuals reintegrate and avoid reoffending. The immediate outcomes of the implementation. Decreased arrest and incarceration. With early intervention and proper screening, individuals with mental health issues are more likely to receive treatment rather than incarceration. Reduce violence and recidivism. CITs and trauma-informed approaches would reduce instances of violent behavior and criminal interactions and offer individuals the chance to rehabilitate rather than reoffend. More effective rehabilitation. Integration of mental health and criminal justice professionals would lead to a more effective and tailored approach to each individual's needs, promoting rehabilitation. The long-term outcomes. Lower recidivism rates. The collaboration and systemic integration would lead to a better rehabilitation, lowering the likelihood of individuals reoffending and returning to the criminal justice system. Improved public safety. As individuals with mental health issues receive proper treatment and support, the number of violent incidents involving individuals with untreated mental health issues may decrease, leading to a safer society. Lastly, cost-effective. Reducing incarceration rates and focusing on rehabilitation can lead to a long-term cost savings for the criminal justice system. Feasibility. The proposed model is feasible but would require significant commitment from stakeholders and careful planning. Some of the key challenges to address would include funding and resources, policy and legal framework, collaboration and coordination, and fighting the stigma and public perception. The stakeholders' role in planning and implementing this model. They would need to loop in law enforcement officers, mental health professionals, social services and community organizations, government and policymakers, and especially the public. And in conclusion, implementing this new integrated model would improve the handling of the mental health issues in the criminal justice system, leading to more effective rehabilitation, lower recidivism, and better outcomes for individuals with mental health disorders.